A very pleasant good afternoon and welcome to the Ken Rampersaud Show here on Island Zone Radio and on Facebook Live. Well, it's good to be back, and yes, we have to praise God and thank God for every day that we are alive. Life is a very special thing, and for those of you who know someone who had a COVID-19 or who are sick, know how valuable this life is. We have lost so many people during the past year due to COVID-19. So guys, I want to tell you, please be careful, wear your mask, practice social distancing. Also, I want to tell you, not because the vaccine is out, that means you're going to be reckless out there. Please, by all means, continue to wear your mask and practice social distancing. You can still pass this virus on. I am alive, and thank God. I've been having some nasal problem. My sinus strip is bothering me. I'm coughing all the time, but thank God I am well today. So good to see some of you guys locked on with me today. And when I see some of you guys' name, I have to smile because it's good to see you guys. Maria, she said, we miss you, Ken. I miss you guys. I'm glad I was home all day. I am refreshed and I am ready for today. My beautiful Maria Harris, good to have you on my side. Narayan Ramru, continue to be the good soul that you are. Nanda C, a very good afternoon to you. My good friend Priya Prasad, thanks for watching all the way from Guyana. My sister Anita Ish Dowlat Ram and my brother-in-law watching all the way from Toronto, Canada. I can't wait for a trip to Canada to just relax a little bit, you know. Winifred Pompey, good evening to you, sir, and thank you very much for tuning in on the show. Fidel Singh, first time I'm saying this name, but welcome to the Ken Rampersaud Show, which airs every Sunday afternoon from 5 p.m. until 7 p.m. Also, I want to tell you guys that Selector Bolt is playing the music for us this afternoon, and I always like to play a religious song, a good song to start the program, because I'm always grateful for life and for everything, all my blessings. My cousin Sonia Andrew, thanks for watching, my dear. Good to have you on. Natasha Tambron, a very good evening to you. And she liked the song. That's a good thing. Rajiv Nandalal is watching. He is in studio. The beautiful Bibi Hack, thanks, my dear, for watching. It's always good to have you on. And guys, please be safe. Also, to Nadia, watching all the way from Canada. That's the lovely wife of our selector in Canada. So good to have you on, my dear. Please share the program to your friends. You know, today's program, I'll be talking about Alzheimer's disease. How do we take care of the elderly population who's with us now? And we know a lot of people that's living many years now, longer years. So we have to know how to take care of them. And we know that a couple of weeks ago, one elderly guy in our community was found dead near a dumpster right here in Queens, New York. So when I hear of these things, I'm wondering to know, without judgment, how can I help our community in all this area? How can we safeguard those who are suffering from dementia and Alzheimer's disease? So today I will go into detail how we can help them. I'll talk a little bit about Alzheimer's disease and some of the food that we can eat. So it's good to have you guys on. I'm going to let the DJ come on with another song. And when he come back, we will talk about Alzheimer's disease. It's good to have Pamela Jeffers Sanchez watching all the way from Pennsylvania. Amrita Suki, thanks for watching. Hemrani Savory, a very good afternoon. Zareen, good evening to you. One person who has been very supportive to Island Zone Radio, Rowena Lal, good afternoon to you from New York. And I know that you are in sunny Florida. Golden Singh watching all the way from Canada. I'm hoping that I'm sounding good in you guys' ears this afternoon. Our good friend of the show, Michael Nalini Naidu, always good to have you guys on. And Priya says, always looking forward to the Sunday afternoon. And I have to tell you guys, I'm very glad to have you guys. And thanks so much for choosing to spend a Sunday afternoon with the Ken Rampersaud Show. and all our viewers. I know that you guys can do better things, but let's together help me, and I help you. I do some of the work, and I bring the information to you guys, and you can always share it with your friends and your family and help safeguard our population. So let's see who else we have here. Radhika Ramnandan, all the way from Guyana. It's good to have you on. It's good to get all you guys beautiful messages from Guyana and elsewhere. Elizabeth Lowe, a very good afternoon to you guys too, and I miss all of you. Let's go with DJ with another good song, and when we come back, we'll go straight into Alzheimer's disease and how we can help our older population. Let's go, DJ. That's the man, Apache Warrior and Terry Dheeraj. Let's go run that from the top. Terry Dheeraj and Apache Warrior, always a warrior supporting us. That's right, that's right. The man himself, Apache Warrior, singing that song there along with Terry G. And as we know that these guys make significant contribution towards our Guyanese population, and I want to do the same thing to support them. So one of the things that I've learned over the past couple of months is that this guy, Apache Warrior, I know him in a more tangible way. a very giving guy. One of the things that he doesn't do is to advertise what he does, but he really gives back to our community. And I want to say thank you very much. I know Terry G also does the same thing. So, guys, we must support those in our community. Again, today, our conversation will be about Alzheimer's disease. And why I bring this into conversation today is because a couple of weeks ago I found out one of our elderly population, one guy, he was found dead near to dumpster here in New York. So we want to, as we go into the program, we want to stop these kind of thing from happening, from preventing it. I see Harish is watching. A very good evening to you too, Harish. Some of you guys' name I don't see, and for all of you who's watching and I don't see your name, I want to say thank you very much. Make a comment, and so I will see who is watching. And I thank you very much for all of you who I don't get to see, and to say thank you very much. The beautiful Veronica Singh is watching all the way from Canada. Good to have you on. So let's go. As we know, Alzheimer's disease is a progressive neurologic disorder that causes the brain to shrink and the brain cells to die. Alzheimer's disease is the most common cause of dementia, continuous decline of thinking, behavioral and social skills that affect approximately 5.8 million people in the United States. Also, it's had a lot of problem with inability to function independently. We have our older person and they cannot think sometimes. And also it affects those who are 65 years and older living with Alzheimer's disease. Of those, 80% are 75 years older. So we know that it affects those older population. Out of approximately 50 million people worldwide with dementia, between 60% and 70% are estimated to have Alzheimer's disease. The early signs of the disease include forgetting recent events or conversations. As the disease progresses, a person with Alzheimer's disease will develop severe memory impairment, and that's why sometimes we want to know what's going on. We see our elderly population, your father, your mother, your grandfather, they are not remembering things, and we want to know what's going on. The loss of the ability to carry out everyday tasks, medication may help temporarily improve or slow progression of the symptoms. And what I want to see again, to reiterate, it temporarily improve or slow the progression of the symptoms. This treatment can sometimes help people with Alzheimer's disease maximize function and maintain independence for a time. Different programs and services can help support people with Alzheimer's disease and their caregivers, especially here in the United States, Canada, and a lot of places around the world. I don't know how much they do for the people in Guyana and what kind of services they have. There is no treatment that cures Alzheimer's disease or alter the disease process in the brain. In advanced stages of the disease, complication from severe loss of their brain function, such as dehydration, malnutrition, or infection, which results in death. And let's talk about some of the symptoms. And when we talk about the symptoms, we're talking about some of the things that the patient feels. Again, when we talk about symptoms, is what the patient feels. Memory loss is the key symptoms of Alzheimer's disease. Early signs include difficulty remembering recent events or conversation, and disease process. Memory impairments worsen and the symptoms develop. At first, a person with Alzheimer's disease may be aware of having difficulty remembering things and organizing thoughts. And do you know that some of us are very young and we wonder sometimes what's going on? Why are we forgetting things? Sometimes we put up things and we forget where we put them. We put them up for safekeepings. But I'm not talking about that kind of memory loss. I'm talking that an older person forgetting their stuff, forget where they put their money, and we can't find it, and they have the whole family in an uproar. A family member or friend may be more likely to notice how the symptoms worsen, and that is because you are with them constantly. You're the one who would notice. Sometimes they don't know what's going on, okay? Brain changes associated with Alzheimer's disease lead to growing trouble with memory, and as we said, it's about all memory. Everyone has occasional memory lapse, as I said, but the memory loss associated with Alzheimer's disease persists and worsen, affecting the ability to function at work and at home. And if you have Alzheimer's disease, I don't recommend that you really go out there and work. And one of the things that I've noticed here, especially in the United States, I don't know about Canada, but people are 75, 80 years old and is still working. I truly believe that people at that age, they really need to be home, relaxing, and enjoying their retirement. I'm going to ask DJ to get a song ready while I talk a little bit more. People with Alzheimer's disease may repeat statements and questions over and over, forget conversation, appointments, or events, and not remembering them later, routinely in misplaced possessions, often putting them in illogical locations, get lost in particular places, eventually forget the names of family members and everyday object, right? Sometimes we want to know how our elderly would see someone or hear someone that's there, and we don't know what's going on. And we say, what's going on? How can you come that this individual is forgetting? And that's an early stage of Alzheimer's, okay? Having trouble finding the right words to identify objects, express thoughts, or take part in the conversation. And let's go. We're going to have DJ to play another song for us. Guys, enjoy the show. And this, you know what? Sometimes I say, this is one of a kind show, especially from Guyanese. And I bring these shows so that we can help our own Guyanese population and preventing things from happening. There's a lot of safety information I'm going to share with you guys today. Okay, let's go, DJ. You're watching the Ken Rampersaud Show here on Island Zone Radio.
Yesterday I saw you right away, girl. I knew in my heart that you will love me too. Now today I am here and you are over there. You're the one that I want, girl, I swear.
Special good evening to the man John from Queens.
Surprise, no, I'm not telling you no lie. You're the one I want to be with till I die. Girl, you took my heart by surprise. No, I'm not telling you no lie. You're the one I want to be with till I die. Yesterday I saw you right away, girl. I knew in my heart that you will love me too. Well, it's your boy American, alongside the keyboard god. Some people say that they don't believe in what we calling love at first sight. I want to tell you, baby, I love you, and I know this feels right. Some people say that they don't believe in what we calling love at first sight. I want to tell you, baby, I love you, and I know this feels right. I love you so, don't ask me why. If you should go, I'll surely die. Girl, you took my heart by surprise. No, I'm not telling you no lie. You're the one I want to be with till I die. Girl, you took my heart by surprise. No, I'm not telling you no lie. You're the one I want to be with till I die. Yesterday I saw you right away, girl. I knew in my heart that you will love me too. Now today I am here and you are over there. You're the one that I want, girl, I swear. Girl, you took my heart by surprise. No, I'm not telling you no lie. You're the one I want to be with till I die. Girl, you took my heart by surprise. No, I'm not telling you no lie. You're the one I want to be with till I die. Yesterday I saw you right away,
That's right, that's right. You're watching the Ken Rampersaud Show here on Island Zone Radio. I want to say thank you guys for watching the show. Bansi Prasad, a very good evening to you. Rihanna Abimullah, thank you very much for watching. And yes, you can have early onset of Alzheimer's, but as the show progresses, you will get to learn much more. Um, Maria, thank you very much and good evening. And she's saying, please share the program. Let's see who else we have here. My good friend Radha Totaram, who has always been supportive to Island Zone Radio. Thank you very much, my dear. It's always good to share. It's free and it's good information that we are sharing here today. John from Queens, the #1 YouTuber here in Queens, guys, and always support him. He always have these nice girls dressing up and doing great things for him. So, John, thanks for watching, and he's always supporting us. And Himrani Savory is saying very good information. Thank you very much, my dear. So, guys, please save. There's a lot of information I'm going to share with you guys today. Also, thinking and reasoning. Alzheimer's disease cause difficulty concentrating and thinking, especially about abstract concepts such as numbers. And we want to know that abstract thinking is the ability to understand the concept that are real. Multitasking is especially difficult. When we talk about multitasking, they can do a lot of things one time. They want to focus and do one thing, and it may be very challenging to manage finance, balance checkbook, and may pay bill on time. And one of the things is, as I was reading and preparing my the topic, I said to myself, we should not have people who forgetful doing financing and balancing checkbook and do all these fancy things. I'm hoping that they should have their family member who help with all these things. Eventually, a person with Alzheimer's may be unable to recognize and deal with numbers, making judgments and decisions. Alzheimer's causes a decline in the ability to make reasonable decisions and judgment in everyday situation. For example, a person may make poor or uncharacteristic choice in social interactions or wear clothes that are inappropriate for the weather. And sometimes I know I have patients who, during summertime, they want to go outside and wear winter clothes. So these are things that you have to pay attention to, how someone dresses when they're going out, especially in the winter month. It's cold out there, and if you see they're just wearing a vest to go outside, as family members or friends or family, you want to know what is going on. And you have to question if they're going through any kind of Alzheimer's, dementia, what's going on. It may be more difficult to respond effectively to everyday problem such as food burning on the stove or unexpected driving situation. And I discuss this a little bit because you know, a lot of times, as some of you, if you're listening to me for the first time, I take care of about 60 clients in a building. And a lot of times, what they will do, and they're older patients that I take care of. Some of them have Alzheimer's. They will put the food on the stove to cook, and they will forget it on, and the food will burn. It will start fire. The fire alarm would go on, and it is a big safety concern. We will talk about safety in just a bit, but just to let you know, also planning and performing familiar tasks, once routine activities that require sequential steps such as planning and cooking a meal or playing a favorite game become a struggle as the disease progresses. Eventually, people with Alzheimer's disease often forget how to perform some simple and basic tasks such as dressing and bathing. And sometimes you will go in the bathroom and you will see them there and you don't know what's going on. And before I forget, I want to say my deepest sympathy to Deo Moti. He lost his father a couple of weeks ago in Orlando, Florida. And for those of you, I know Deo Moti family for many years, for all my life. I used to visit their home, very respectful family. And you know what, that has passed on to Deo Moti because Deo Moti is such a pleasant young man. So Deo Moti, on behalf of the Ken Rampersaud Show and all our viewers, we'd like to extend to you our deepest sympathy. Also, we know that Dave Yankaran, he lost his mother-in-law in Schenectady a couple of weeks ago. On behalf of the Ken Rampersaud Show, I know you're a very supportive guy in our community, and I want to say on behalf of myself, all our viewers, our deepest sympathy to you. I know that God has a plan, and may your mother-in-law find a resting place in heaven. I just want you guys to know I pay attention to you despite, and I am not doing the show just to do the show. Um, you guys are an important part in my life. I do pay attention to what's going on in our community, and when there is something that's bad, I like to jump in and show my sympathy or to show my love and appreciation. Okay, so let's go. Changing in personality and behavior. Brain changes that occurs in Alzheimer's disease can affect mood and your behavior. Problems may include the following, which is depression, apathy. And when we talk about apathy, we talk about feeling indifferent or lacking of emotion, often of depression or misuse of alcohol or drugs. Social withdrawal, and sometimes the family will have things, occasions, party or whatever, they don't want to go. They will experience some kind of mood swings, distrust in others. And I don't know if you have experience with some older people. A lot of times who have Alzheimer's and dementia, they don't trust a lot of people. So you have to really pay attention of what's going on. Irritability and aggressiveness, changes in sleep habits. You will know sometime you have those your older family members, they're not sleeping. Change in sleep pattern, you may note it. Sometimes they sleep all day and wake all night, and it could really cause havoc in your life. Especially that you want to see, you work all day and you're coming home, you want to sleep at night, and you want your family to sleep at night too. But things have changed. But there's so many help in this time that you can help your family in living a very good and comfortable life. Also, you have people with Alzheimer's and dementia, they'll be wandering all over the place, and that's not a good thing. And that's one of the safety issue we have, which I'll address later on. And there's something important I want to tell you guys. I wouldn't give it away. It's not that big, but it's something that could save someone's life. Loss of inhibition, less self-consciousness, and more anxious, that you can create dangerous situation for yourself, and we don't want that to happen. Delusions such as believing something that was stolen. Also, preserve skills. Many important skills are preserved for a longer period, even while symptoms worsen. Preserved skills may include like reading or listening to books, telling stories and reminiscing, like singing, listening to music, dancing, drawing, or doing craft. These skills may be preserved longer because they are controlled by part of the brain. And I want to tell people, a lot of times I see a lot of older people, especially from our Guyanese counterpart. When you get older, we think that the best thing to do is to sit one place and don't do anything. I've always tell people, as a nurse for over 30 years, I have said, one of the best things that you can do is keep your brain occupied. Do things, especially get a pen and paper and write, draw, play cards. If you and your husband or partner, whoever it is, keep them occupied. Do things that's interesting, that would help them in terms of motivating them. You have Scrabbles, you have so many different things that you can help them to think. I'm going to ask DJ to get another song while I talk. When do you really need to see a doctor? A number of conditions, including treatable conditions, can result in memory loss and other dementia symptoms. If you are concerned about your memory or other thinking skills, talk to your doctor for a thorough assessment and diagnosis. If you are concerned about thinking skills you observe in a family member or friends, talk about your concerns and ask about what you can do together and help them when you go to the doctor. And it is a good thing to do when your family member is sick or having these kind of things. You take them to the doctor with you. You let the doctor know what's going on, because sometimes your older population do not remember what to say. And if you can't go with them, you can send the home attendant or you send a note to the doctor. And let's go with another song. You're watching the Ken Rampersaud Show here on Island Zone Radio and on Facebook Live.
You don't know what you have until it's gone.
I'm going to ask the DJ to pull that one all over again because I want to talk about a little bit about this song. And it is so true that in life, sometimes we don't know what we have until they are gone. So, guys, if you have your wife, your lover, your husband, whomever you have, domestic partner, treat them good, give them love and respect so that you guys can stay together, okay? And not only talk the talk, but dance the dance. Let's go with the song. It's a favorite song of mine that just came out not too long ago. Let's go.
Ficadi. You don't know what you have until it's gone. You don't know what you have until it's gone. Now you're up and gone away, baby. Didn't wanna stay, baby. I wasn't to play, baby. I just want you here, baby. Where you really want me to. Should I know my love for you is true? Girl, you been telling me that you're never gonna leave. Girl, you been telling me that you.
This song for all you beautiful ladies.
Girl, you been telling me that you're never gonna leave. Girl, you been telling me that you're never gonna leave. When you listen to the lies that they filling you inside, girl, don't believe. They go try everything to make we unhappy. When you listen to the lies that they filling you inside, girl, don't believe. They go try everything to make we unhappy. Oh, jealous people want we only end up in fight. Girl, they wanna fool you, saying I ain't doing you right. Got up of me, girl, you know the truth. Girl, you been telling me that you're never gonna leave. Girl, you been telling me that you're never gonna leave. Girl, you been telling me that you're never gonna leave. Girl, you been telling me that you're never gonna leave. My love is so kind, girl. Follow your mind, girl. Follow your heart. They go try everything, girl, to drive we apart. My love is so kind, girl. Follow your mind, girl. Follow your heart. They go try everything, girl, to drive we apart. Oh, jealous people want we only end up in fight. Girl, they wanna fool you, saying I ain't doing you right. Got up of me, girl, you know the truth. Girl, you been telling me that you're never gonna leave. Girl, you been telling me that you're never gonna leave. Girl, you been telling me that you're never gonna leave. Girl, you been telling me that you're never gonna leave.
That's right, that's right. And while I talk about Alzheimer's disease, I also like to share a little bit about love and peace and tranquility. You know, I've always believed in love. Love always conquer and all love always win. And I've always tell people that you get a good wife, you cherish them. You get a good husband, you cherish them. Because there are not so many, a lot of good people. There is good people in the world. But man, when you find someone to love and to cherish, and that someone who love you and cherish you and go the extra mile to make the relationship work, you hold on to them and give love. Love conquers all, like I said, and give it your best shot. Always give it your best shot. And it is so true. I have found in life, I'm 56 years old, there's so many things that come into your love life that could cause problem. But if you and your partner stay together, you can conquer anything. I've always, that's one of the conversation Geeta, my lovely wife, have a lot of times, that I said no matter what comes our way, we would storm the storm. We will stand up like a big pillow and be there for each other. And like I tell people sometimes, and people think that I'm a perfect life. I have a perfect life. I do have all the things that goes on in life: love, hate, jealousy, all the things that you could think about. But sometimes I try to weather the storm and to be a good soul. I know it is very easy to choose the wrong path and to do the wrong things, but it pays sometimes, especially when you have a good partner in life. Let them know one of the things that it's good to do. And, as we are talking, a lot of times we don't let our partner know how we feel about each other. And I want to tell you one thing. I love when Gita tell me I love you. And I know that she loves when I tell her I love her 3, 4 times a day. And it is not a day goes by that I tell my wife every day how much I love you and how much you mean to me. And if you're not doing that, guys, sometimes start. You make your partner feel important. Let them feel love. It's not going to hurt if you let them know how much you love and how much you care for them. Even if you write a little note and put a note in their bag so when they go to work, they see a little note that says, I love you, honey. Let's get back to what could cause Alzheimer's disease. The exact cause of Alzheimer's disease aren't fully understood, but at a basic level, brain protein fails to function normally, which disrupt the work of the brain cells, which is the neurons, and triggers a series of toxic events. Neurons are damaged, lose connections to each other, and they eventually die. Scientists believe that for most people, Alzheimer's disease is caused by a combination of a few things: of genetic, lifestyle, and environmental factor that affects the brain over time. We know that less than 1% of the time, Alzheimer's disease is caused by a specific genetic changes that virtually guaranteeing a person will develop this disease. These rare occurrences usually result in a disease onset in middle age, as I said, middle age, and damage most often start in the region of the brain that controls the memory, but the process begins years before the first symptoms. As we said, but the process begins years before. So this is all working for a long time. And then later on, all the signs and symptoms may manifest the signs and symptoms. The loss of neurons spreads is in a somewhat predictable patterns to other regions of the brain by the late stage of the disease. As we know, it share around the brain, and the brain has shrunk significantly. It's not the same size. Researchers trying to understand the causes of Alzheimer's disease are focused on the role of two proteins, and you really don't know need to know this, but I'll just mention it. The plaques, beta amyloid, is a fragment of a large protein. When these fragments cluster together, they appear to have toxic events. Just like when you have cholesterol buildup in your heart or your vessels, the bigger it gets, the worse it is for you. Also, the tangles, you don't want that to happen in Alzheimer's patients. These proteins shape and organize themselves to structured called neurofibrillary tangles. These tangles disrupt the transportation system and are toxic to different cells in the body. And we want to know what are some of the risk factors, what risk factors you may have that would cause this. And we want you to know that increased age is the greatest known risk factor for Alzheimer's disease. This is not a part of normal aging, as I want to tell people, but as you get older, the likelihood of developing Alzheimer's disease increase along with so many other diseases. And listen to this, Priya. I know that you asked a question just now. At what age it started, and one study, for example, found that annually there are 4 new diagnoses per 100,000 people aged 65 to 74, 32 new diagnoses per 1,000 person 75 to 84, and it's 76 new diagnoses you get 1,000 people aged 85 or older. So we see as people get older, things I said the track to start to the bad things start to happen. We get diabetes, we get hypertension, we get stroke, all these different things. But there are so many things that we can do to slow up these things. As we said before, also family history and genetics, your risk of developing Alzheimer's is somewhat higher in the first degree relative your parents or sibling has the disease. So if your family has Alzheimer's, chances are that you are going to get it. But most genetic mechanism of Alzheimer's among families remain largely unexplained, and the genetic factors are likely complex. One better understood genetic factor is a form of the protein, a variation of the gene ApoE4 increased Alzheimer's risk. And you guys really don't need to know that, but I'm just saying this. We're going to ask DJ to get another song while I tie up this here. I wonder if you guys want to hear the same song that was played just now by Vicardi. Let's see if you guys want it. You can press 1 if you want to hear it again. And DJ is going to watch the shoutbacks. And if you guys want it again, we play it for you again. Again, the show is for you guys. Approximately 25 to 30% of the population carry this gene, okay? But not everyone with a variation of the gene develop the disease. Scientists have identified rare changes, which is mutation in 3 genes that eventually guarantee the person who inherit one of them will eventually develop Alzheimer's, but these mutations account for less than 1% of Alzheimer's disease. Let me say hello to the man himself. So DJ, they want to hear that song again, so come back with another song, the same song. And we want to say thank you very much for the man, Albert Rampersaud from Schenectady, always supporting us. Although he's a DJ, he finds time to listen to all of us. And I want you to know that I appreciate all that you do. Also, if you're looking for a DJ in Schenectady area, contact the man himself, Mr. Ramroop, Alvin Ramroop. I see all of you guys want to hear the song. You're going to get it. Hello to everyone. Have a blessed night. Stacy Mahez, good evening. Maureen Imran, Hemrani Savory, you guys going to get it. And May, a very good evening to you. Priya Prasad, wow, thanks for sharing. And May is from Guyana, I think. Nanda C, good evening to you. The man again, Underground Songs, which is Alvin Rampersaud. Ramsaroop rather says, you're absolutely correct. Love is very important. Let's go, DJ. By popular demand, the beautiful song, the number 1 song in my
Vicardi. You don't know what you have until it's gone. You don't know what you have until it's gone. Now you're up and gone away, baby. Didn't wanna stay, baby.
Good evening to my aunt, Dolores Sigobin.
I just want you here, baby, where you really want me to. Should I know my love for you is true? Girl, you been telling me that you're never gonna leave. Girl, you been telling me that you're never gonna leave. Girl, you been telling me that you're never gonna leave. Girl, you been telling me that you're never gonna leave.
Love could be a very confusing thing. Good evening to Ryan Jeffrey. Maureen Imran, all the way from BVI.
Listen to the lies that they filling you inside, girl, don't believe. They go try everything to make we unhappy. When you listen to the lies that they filling you inside, girl, don't believe. They go try everything to make we unhappy. Oh, jealous people, want we only end up in fight. Girl, they wanna fool you, saying I ain't doing you right. Caught up of me, girl, you know the truth. Girl, you been telling me that you never gonna leave. Girl, you been telling me that you never gonna leave. Girl, you been telling me that you never gonna leave. Girl, you been telling me that you never gonna leave. My love is so kind, girl. Follow your mind, girl. Follow your heart. They go try everything, girl, to drive we apart. My love is so kind, girl. Follow your mind, girl. Follow your heart. They go try everything, girl, to drive we apart. Oh, jealous people, want we only end up in fight. Girl, they wanna fool you, saying I ain't doing you right. Caught up of me, girl, you know the truth. Girl, you been telling me that you never gonna leave. Girl, you been telling me that you never gonna leave. Girl, you been telling me that you never gonna leave. Girl, you been telling me that you never gonna leave.
That's right, that's right. That's my number one song. I always believe in love. And you know, as we're talking about love, it makes your heart grows. So you know what? If you are two adult and you fall in love with each other, I would say go for it. It's a very special feeling, and I would only hope that all of us get to experience what love really is all about. How it makes your toenail crawl, right? And if some of you really fall in love, we know it's a good experience. It makes you feel good. You could press thumbs up in the shout box. It's good to see people from watching from the BVI. Good to have people around the world. Tell us where you are from. Good to have Ryan Jeffrey on, the man who controls Island Zone Radio. Rose Prashad, a very good evening to you. And yes, Judy Ledra, a very good evening to you too. He says, waiting for the female. I'm glad you say that, Judy. To be very honest with you, when I hear this song, I want to write the female version of this. Unlike you, I want to hear it. Probably I should put some words in. Also, as we're talking about love, I want to tell you that love never hurts. So if you are in a relationship that's bad, that your husband is beating you or your wife is beating you, that's not love. Love is compromise. You love each other, you do things for each other. It makes the relationship work. Okay? So go for it. Fall in love. And let's talk about Alzheimer's disease, Down syndrome. Many people with Down syndrome develop Alzheimer's disease. This is likely related to having 3 copies of chromosome 21 and subsequently 3 copies of the gene for the protein that leads to the creation of beta amyloid. Signs and symptoms of Alzheimer's disease tend to appear 10 to 20 years earlier in people with Down syndrome than they do for the general population. So we know that if you have any relative with Down syndrome, now sometimes down the line that they can develop and will develop Alzheimer's disease. And we want to know the sex. Who gets it more? There appear to be a little difference in risk between men and women, but overall there are more women with the disease because we know that generally um, the women live longer than men. I wonder why men dine out and leave these women. Is it because of stress? Let's hope not. And we talk about mild cognitive impairment. Mild cognitive impairment is a decline in the memory or other thinking skills that is greater than normal for a person's age, but the decline doesn't prevent a person from functioning in social or work environment. People with mild cognitive impairment um, has a significant risk of developing dementia when the primary mild cognitive impairment happens. This diagnosis of mild cognitive impairment encourage of a greater focus on healthy lifestyle changes, develop strategies to make up for the memory loss and scheduling regular doctor appointment to monitor these symptoms. And there is things that there is medication to help out there with the signs and symptoms. Also, we know that people with head injury, people who have severe head trauma, have a greater risk of Alzheimer's disease. Several large studies found that in people aged 50 years old or older have a traumatic brain injury, the risk of dementia and Alzheimer's disease increased. The risk increased in people with more severe and multiple brain injuries. Okay, we also talked about earlier about air pollution. Studies in animals have indicated that air pollution particulates can speed degeneration of the nervous system, and human studies have found that air pollution exposure, particularly from traffic exhaust and burning wood, is associated with greater dementia risk. So it's no good to be around a lot of burning woods, cigarette smoking, and all these kind of things. Excessive alcohol consumption. A lot of people like to drink and they drink a lot. So drinking large amount of alcohol has long been known to cause brain changes. Several large studies and reviews found that alcohol use disorders were linked to the increased risk of dementia, particularly early onset of dementia. We talk about sleep. We know how important it is for us to sleep. Research have shown that poor sleeping patterns, such as difficulty falling asleep or staying asleep, are associated with increased risk of Alzheimer's disease. So, guys, I want to tell you one of the good things to do is to always make sure you get some good sleep, but don't sleep half of your life away. If you get my drift and what I'm saying, you get 7 to 8 hours night sleep. That's a good thing. We talk about lifestyle and heart health. Research have shown that some risk factors associated with heart disease may also increase the risk of Alzheimer's disease, which includes the lack of exercise. As we get older, we must exercise. It's important. Obesity, a lot of us, we obese and we don't do anything about it. Smoking or exposure to secondhand smoke, high blood pressure, high cholesterol, poorly controlled diabetes, especially type 2, these factors can all be modified. Therefore, changing lifestyle habits can be some form altering to your risk. Okay, as we said, for example, we want you to exercise regularly and a healthy low-fat diet. And when we talk about exercise, it's always good to exercise at least 5 days a week, which I've always talked all the time. At least 5 days a week, half an hour a day, and you can do simple things. Don't kill yourself trying to exercise. Exercise so you can live longer. Also, for example, regular exercise. You walk. You can walk up your steps. If you're living in the cold, you could walk back and forth in the house. Also, eat a lot of rich fruits and vegetables that are associated with the decreased risk of developing Alzheimer's disease. I will talk about, if time permits, some of the food that you can really eat that would help with Alzheimer's disease. If I don't get to do it today, I will definitely do it next week, because I also want to talk a little bit about some of the food that we can eat to help us to be stronger, especially during this coronavirus pandemic. Okay, lifelong learning and social engagement studies have found that an association between lifelong involvement in mentally and socially stimulating activities and a reduced risk of Alzheimer's disease. Low education level. I was surprised when I was reading low education level, less than a high school education, appeared to be a risk factors for Alzheimer's disease. So go ahead and get your education. And one of the things I tell people, if you didn't get to go to school, don't let that be an excuse for you. Get a book, read. In your spare time, if you're in the train, you're in the bus, get a book, read. Learn to spell 10 words a day, 5 words a day, so that you can increase your vocab and you can go there and be a star. And some of the complications: memory and language loss, impaired judgment, and other cognitive changes. And when we are talking about cognitive changes, higher brain functions such as memory and reasoning caused by Alzheimer's can complicate treatment for other health conditions. And I'm going to ask in about 3-4 minutes, ask DJ to get another song while I close off about Alzheimer's disease and the overview. So I don't know what song you guys want to hear, but we leave that one up to DJ. A person with Alzheimer's disease may not be able to communicate that he or she is experiencing pain, explain symptoms of other illness, follow a prescribed treatment plan, explain medication side effect. And I want to tell you, when you have people with Alzheimer's disease, you want to get like those Mediset pack. You put the medication outside in that Mediset, and you help them to take their medication every day. As Alzheimer's disease progresses, it is the last stage. Brain changes begin to affect physical functions as well as swallowing, balance, and bowel and bladder control. These effects can increase vulnerability. And we know that a lot of older persons, they have constipation, they have problems with their bladder, they have bowel problem, they have swallowing problems. So let's talk about swallowing. When you're feeding someone that's older and they're bedridden, you want to raise their head up, prop their back on their head with a pillow, with a bowel. You want to give them a lot of water to drink. Also, there's a lot of fruits, a lot of fiber. You can give it to them. You can add some prune juice, a cup of prune juice every day to help them. There is fiber stuff that's selling. You can mix in the water to give them to help with bowel. And if they have any bladder problem, you also make sure you always put a Pampers in them so you don't get upset. You have to change them, wet the bed up all the time. These effects can increase vulnerability, as we said, to additional health problems such as inhaling food or liquid into the lungs, which we call aspiration. That's when they're lying down eating. We don't want you to put anybody down to lie down to eat. It could cause aspiration. When we talk about aspirations, we're talking about food slipping into the lungs and would cause the patient to aspirate. They will cough. You will have to hit that person back to get that food out. Also, flu, pneumonia, other infections, fall, fracture. We know a lot of older person, they're prone to fracture if they fall. That's why we want to be very careful. We don't want to leave the house in any kind of way, which we will talk about in a minute. Malnutrition and dehydration. We want them to eat. Constipation, as we said, diarrhea, dental problems such as mouth sore or tooth decay. And sometimes when you have older people, one of the best thing that you can do is to have you take out their denture out of their mouth so that the teeth or the denture would not fall back of the throat. Let's go with another song from the DJ. You're watching the Ken Rampersaud Show here on Island Zone Radio and on Facebook Live. We got DJ is going to play a song. Select a boat. Let's go. One of my favorite, dedicated to all you beautiful persons. Thank you, Missy Boo.
तेरी बिखरी जुल्फें देख देख ये मस्त घटा शर्माई हो देखो मस्त घटा शर्माई तेरा रूप जो देखा झूम झूम ली बिजली ने अंगड़ाई होनी बिजली ने अंगड़ाई काले बाल गोरा रूप जैसे साए में हो धूप तुझे देख जिया भरमा ही गया हो धीरे रे चलो मोरी बाकी हिरनिया धीरे रे चलो मोरी बाकी हिरनिया
Prime Video.
You are watching the Ken Rampersaud Show here on Island Zone Radio, and welcome back. I know it's some of your favorite song. One of the things I see, what's her name says, Michael. I'm going to ask the DJ to get that song back and play it back in our next go round. Michael and Lini Naidu. I want to say, and I thank you very much for staying with me and watching the show, and to all of you guys. I've been a nurse for over 25 years, and along my journey, especially when I'm working with Guyanese, our Guyanese population, a lot of times I'm finding out that people don't know what medication they're taking, or don't know what's going on, don't know how they could help their family, and so on. So I thought to myself, I am not a radio personality, but I thought that with my years of experience, I've had over 25 awards in nursing. And, I have the kind of knack to talk a little bit. And so I give it my best shot. I said, how can I help our Guyanese population, especially Trinidad, our Caribbean population? I don't want to sound biased because I love all my viewers. And I thought to myself, how can I come up with a show to help? And, like you guys know, I'm not perfect. I make mistakes sometimes. A lot of times I make some mistakes, but it's okay because I am not perfect. I try to get good information to you guys and see how best I can help you guys. So, and especially things that are affecting our community, I want to address. And why I came up with this show today is a couple of weeks ago we learned that one of our Guyanese population, one of our Guyanese guy, was found dead near. He was an older guy. He was in dialysis, and he was found dead near a dumpster. And so I am not sure of a lot of things. So what went through my mind, how can I help or how can I advise our family member, our friends, our viewers, how can they help our elderly? How can we save them? How can we help prevent these things from happening? And without knocking anyone, without being judgmental. And, I'm so glad I have my Aunt Laura Sigobin that's watching the show. I've always, my total life, she knows me as a little child, my mom's sister who live in Hartford City, Connecticut. I want to give her some love because, I always am grateful to her because, people like her that make the world a better place. And she was a nurse's aide here in Hartford City, Connecticut. And she brought me to the United States about 30 years ago. And I never forget that she put out so much money for me to come to the United States. And I'm always forever grateful for that one thing that she have done for me. She have given me a great life here in the United States. So guys, that's my Aunt Delara Sigobin who have brought me to the United States. I made one phone call and just let her know I want to come to America, and thank God for her. I get kind of emotional when I say these kind of things, but it's always good to let people know how you feel, how grateful you are, and to let her know that I'm always grateful for this one thing that you have done, bring Kenneth Rampersaud to the United States. And she took a gamble on me, and here it is. I have my own show, the Ken Rampersaud Show. So that's it for that. So go ahead, give her some love and show some appreciation. Because of her, I am here. And yes, that's it for that. So let's see, how can we help our older generation? And always safety should be our number one thing. And here are some of the simple, practical, and effective safety measures to keep senior protected healthy and independent, with more than 26% of Americans 65 years or older living alone. Keeping the elderly safe has become an important concern for family caregivers alike. Being aware of potential dangers mean that we can better prepare in case of an emergency, and that's why I'm having this show. We want to prevent accidents and ensure that our senior loved ones are safe and healthy. We're going to learn how to make elderly homes safe, prevent financial abuse, stay healthy, and more with these easy senior safety tips. And we want to tell you, home senior safety, it's no surprise that the vast majority of our elderly prefer to remain at home. And that just like some of us, one of the things that we want to do is when we get old, we don't want to go to a nursing home. We want to stay in our home where we are comfortable. And sometimes we have to end up taking our elderly at the nursing home because things really out of control. They need that 24-hour care. And so it's such a technical and delicate decisions that we have to make when we have our elderly, okay? It is no surprise that the vast majority of our elderly prefer to remain at home, as I said, and within their communities as they grow older. However, for most Americans, aging in place presents new challenges around home senior safety and injury prevention. And we're going to talk here about some simple tips which is going to help you guys to help make your elderly at home to be safe, right? Declutter your whole house to make sure that you have plenty of space to walk around. Less clutter means less risk of falls. As we know that sometimes, like when I'm doing a home care and I have a case in the home, I see they have chair, they have things all over the place, shoes all over the place, and that's a safety concern. You don't want to do that. You want to make your passageway safe, free of clutter. Make sure that all rugs, anti-slippery pads, and there's things that you can buy under those to put them under the rug so that it doesn't slip. Cover your furniture, the corner to prevent injury. In case there's an accidental bump into them, make sure every room has proper lighting, including walk-in closets. Use night lights to make it easy for them to see. Like, for example, we have two elderly in our home, and one of the things I do, we have a light in our bathroom that I say 24 hours a day, so you can see in the walkway too. Make sure every room has a light, as I said. Install light switch at the top or the bottom of your staircase, because it doesn't make sense that you have one switch that when you go upstairs you can take it off, so there is some problem. If your home have different levels, use proper markings and make sure that they are visible to prevent falls. Risk use cord covers for all cords and cable, or secure them out of the way behind furnitures. We want you to use handrail. Make sure your staircase, all of them have handrails. Remove all carpets from stairs. Again, listen to this. A lot of people like to have carpets in the stairway and staircase to prevent slip. We want to remove those things. Also, it's no good because it's half dust. If you're like me and you have allergy problem, make sure you remove it so that it could have less dust and so on. If you have problem going up the stairs, consider installing a stair lift, and it's a good thing to have. Pay attention to the height of your bed. We want to tell you, especially for the elderly, if your feet can touch the floor while sitting on the bed, it means that your bed is too high. Again, you want to, when you sit on the bed, your feet can touch the bed, and try lowering it by removing the box spring, okay? Similarly, if your knee are higher than your hip while sitting, it means that your bed is too low. In this case, try adding a box spring. Also, what you can do if you want, you can take a piece of wood, make something like a little step, but it must be sturdy, and put it at the bottom of your bed. But try not to, you want to avoid that so that you don't want to step when they're coming down on the bed, especially if they want to go to pee and so on. Place a lighted lamps close to your bed and make sure you can reach them very easily. A lot of times we know that especially here in the States, I don't know, you have those kind of lamps where you can just touch them and excuse me, you can touch them and you can increase the amount of light that you need. It's good to have one of them, especially in your room. So and you can even have a little damp light so they could see what's going on in there. Also have all the items that you use frequently within easy reach in the kitchen. Don't place them on high shelves that are hard to find. You want to especially grab bars in your bathroom for safety. Use rubber mats in your shower or bathtub to prevent a slip. You know, I'll give you this joke. One time I went to Canada. I don't know how I slipped in the bathroom and I fall. It was a joke for me back then. I was younger, but I could not even break the fall. So guys, make sure you put something at the bottom of your bathtub to, in case they slip, you would prevent them from slipping. Also, use shower chairs if you have trouble standing while showering. If you have hot water boiling, don't set your thermostat to be too hot. Instead, use a medium setting to avoid burning or scaling. We will come back with more safety tips while DJ get another song. I'm going to say hello to some of you guys. Missy Boo, thanks for watching. Mala Harpersad, good to have you on. The man himself, Kayum Khan, police officer from Guyana, who is making tremendous contribution to our Guyanese population. And it's always good to have your support. Kayum and the family, I know them very well. He's such a lucky guy to fall into such a beautiful family. I know his wife family for more than 30 years. And I have to tell you, his father-in-law is one of the best you can find out there, has been supportive to his family, to his daughters. I know his wife died when she went to Guyana, and this guy, Kayum father-in-law, he took care of his daughters, and they're all doing wonderful in the United States. I'm going to say hello when I come back to you guys. I have to drink some water. Let's go, DJ, with a song. So, Kayum, it's good to have you on. Let's go, DJ. You're watching the Ken Rampersaud Show. For all the beautiful ladies watching, and especially to my Aunt Laurie Sigobin, Missy Bo, to you too.
मोम हो अंगारों
नशा ही गया हो धीरे रे चलो मोरी बाकी हिरनिया धीरे रे चलो मोरी बाकी हिरनिया तेरी बिखरी जुल्फे देख देख ये मस्त घटा शर्माई हो देखो मस्त घटा शर्माई तेरा रूप जो देखा झूम झूम ली बिजली ने अंगड़ाई होली बिजली ने अंगड़ाई काले बाल गोरा रूप जैसे साए में हो धूप तुझे देख जिया भरमा ही गया हो धीरे रे चलो मोरी बाकी हिरनिया धीरे रे चलो मोरी बाकी हिरनिया कमर न लचके हाय सजनिया धीरे रे चलो मोरी बाकी हिरनिया धीरे रे चलो मोरी बाकी हिरनिया
That's right. Welcome back to the Ken Rampersaud Show. And you know, as we were talking about Kayum Khan, as we were talking about his father-in-law, you know, one of the things that I like, it's always good to have people who's going to bring the best out of you. It's a good thing to have people who's going to bring the best out of you in life. And we always want to be kind and good. Sometimes we have people who just bring the bad out of us. And with and just an advice, we have to stay away from those kind of people. And so, Kayum, I tell you, you are very blessed to have a father-in-law like him that's making such a significant contribution in life. Especially, you know, he is always with his grandchildren, and I've always respect those who added their grandchildren in their lives. So let's go. Priya said, I love this show, Ken. Well, thank you very much. I'm feeling good today too. Love this show. Very inspiring. Thank you very much. Miss Bo, you know, I'm your friend on Facebook and I see you all the time. But I want to tell you a very special thank you for joining in the show today. It's always good to have you guys who join in my show and to support me. You know, I am not the guy who are your celebrity. I, like a lot of radio guy, I am just your poor, humble guy, just bringing some information for you guys, okay? And that's how I want to be looked at. Just humble enough to share my information with you guys. And I'm no better than anyone else. I want you guys to know that. So if you see me on the street or any show, you come tap my shoulder, hey Ken, what's up? That's good enough for me. And a lot of times I know some people write, you know, sir. And so I see Kayum write sir. I tell people Kenneth is good or Ken is good enough for me because I am just like you. Also, we're going to talk a little bit about bracelet, and I want you guys to stick around when I'm going to talk about it, because I'll show the picture what it's about. Also, we're talking about how we're going to safeguard our elderly. We want to check your faucet and make sure that they're easily turned on and off. Make sure all electrical equipment around the house works properly. This includes air conditioned units. Senior are at high risk of adverse effect due to high temperature. And you know, sometimes as elderly, sometimes they don't have that feel, and so they could get burned easily. Service your appliance every 3 to 6 months. Make senior keep important medication in their refrigerator. When we talk about medication, we want you to please watch their medication. Put out their medication they would need. You don't want them to double dose on their medication. Also, it is very important to make sure that any air conditioner is working condition. If you have a clothes dryer, make sure that the vents are cleaned by a professional to prevent the risk of fire. And one of the things I was so surprised, I did not really realize that, you know, your vent, they accumulate a lot of lint inside. I didn't realize that could cause a fire too. So you want to make sure if you have your elderly parents living in the house by themselves, you want to go by there and check, make sure that all of this is cleaned annually, okay? Check to make sure that the kitchen counter are easy for you or them to reach. If they're too high, it's a good idea to lower them to more accessible height. Avoid stepping on wet or damp surfaces. And I know a lot of times if you have tile, it could be very slippery if it's wet. Have a cordless phone at home and help have it at easy reach where they could reach very easily to prevent having to rush to answer the phone when the phone ring. And it's always good to have a bottle of water next to the bedside that they don't have to get up and come downstairs or anything. Do not mix cleaning supplies together. Some substance may be extremely dangerous when combined. Excuse me. And I learned that the hard way when I came to the United States. One time I was cleaning someone's bathroom where I was living, and I mixed ammonia with bleach, and the bathing. I was naked skin cleaning the bathroom, and I nearly died in the bathroom because the fume started to get in my nose, and I had to put on my clothes quick and open up the window and run out to the bathroom. So don't add ammonia and bleach and so on, right? Let's say wear anti-slippery slippers or socks when walking around your house. And I've always say this to our elderly: don't walk barefoot. Wear slippers or something, especially slippery surface such as polished wood floor or tile. Consider purchasing a medical alert bracelet. I want to divulge in this a little bit. I want you to look at your screen now. I'm going to put this band on. Look at this. Excuse me, my throat is bothering a little bit. Look at this band that I'm showing you guys. Take a good look, okay? A lot of times our elderly population is going out to places. They have Alzheimer's, they forget things, they have dementia. They go out in the street, they walk around, and sometimes we have those own way older persons. They just do what they want to do, and then when they reach at the head of the street, they forget where they're going or they forget the address. I know that we had one guy one time, my wife had to take him home because he forgot where he was living. So when you look at the screen on my monitor now, I'm looking at the person's name, their brother, their husband. They're allergic to penicillin, they have diabetes type 1. So this is an alert bracelet, okay? What I want you guys to do, if you have elderly population, always buy one of these things. You can get them at any drugstore. You can go to Amazon and order it. If you have let's say your name is Ken Rampersaud, you put at the top Ken Rampersaud. The bottom you can put Geeta Rampersaud with her phone number. You can put one of the family name there. You want to put if they're allergic to anything, and then at the bottom there, as we're talking about Alzheimer's, you can put the patient has Alzheimer's disease. Also, as we're talking about if they have diabetes, and I'm going to divulge in this a little bit, if the person have diabetes, you want to put that there. So in case the person's sugar runs low, someone find them on the street, they know, and they call 911, 911 come, they know exactly what's happening. So guys, and I don't think that this is kind of expensive. I forget to check the price. I am sure it's less than $20 for one of this medical bracelet that you're seeing on the screen. So guys, please invest in this if you have elderly population, okay? And keep an eye on them that they make sure they wear this all the time. So this is one of the things that I've always want to talk about, especially when I was talking about this show today. So go ahead and buy one of this. And if you like this, I'm not sure if I get it off Amazon or where, but go ahead and get it. If you have problems getting one, let me know, and I can Google it and see where they're selling them. You could check Rite Aid and Dwayne Reed and so on here in New York if you're living. So get one of this for your family, okay? And I'm stressing on this because let's say someone is they forget where they live. You can help them find their family. You don't have to find them dead, okay? So let's continue the show, and we talk about safety outside your home. And I see John is he's putting the show. He's the one that always put my show on YouTube. So I want to say special um, thanks to John for always supporting me from the get-go of the Ken Rampersaud Show. He has always been there, and what I admire about him is that sometimes we have our own that don't support us and support our show. But here it is, you have a stranger and he's a white guy who don't know John from Queens. He's a white man living here in Queens, and he's supporting us. He's taping these things, he's copy them, and sometimes he edit them, put them on YouTube. So we have to congratulate him, and people like him is saving this from when long that I'm gone. We will have information out there, okay, guys? So let's go. And safety outside our home. Injuries and accidents can happen not only inside our home, but also outdoor, on the external premises of our house, our home, on the driveway, on the stairs and porches, in the garage. And here are some simple tips to help you minimize the risk of injuries for fall. As we know, there's a lot of older people that suffer from, by the thousands, older people or elderly that's falling and having fracture hip and fracture somewhere else, the tibia, the fibia. During the winter month, pour salt or sand on your driveway to melt any ice or snow. Avoid walking on ice or wet surface outside your home. Have during different periods, fall assessment from your home health provider, especially if you have a history of fall. And don't leave your house keys under your mat and elsewhere outside your home. Sometimes I feel like putting my keys under the mat, but we always have a hiding place. But thank God I don't have to do that. There's so many people living in our house, so it's good to have a key. Let everybody have their own key. You want to avoid walking on ice and wet surfaces outside of your home. Don't leave your keys, as I said, under the mat. Somebody can come and steal you. That's a safety concern. Stairs are important to elderly safety. They should be kept in good condition and repaired promptly. Make sure all steps are even and easy to access. As we know, sometimes even I am young, and sometimes if I'm not watching where I'm going, I sometimes nearly fall a lot of times. But you have to watch where you're going. And this iPhone is a problem now. People they're not watching where they are walking, and they on their phone. So just be careful. Keep your driveway, porch, deck, and stairway around the house free of any clutter and debris. Outside furniture should be placed outside of the walkway. The yard should be maintained regularly to ensure that there are tripping hazards. There is no tripping hazards. Be especially aware of protruding the trees that have their roots and falling branches. We want to talk about injury risk factors around the house. We're going to ask DJ to get a song ready while I finish off on this. We are not doing too bad with time. Also, uneven surface, we know steps, driveways, sidewalks, inadequate lighting around the home, especially in the porch, in the driveway, and around the stairs. Clutter, porches, and sidewalk, defective and broken outdoor furniture, wet or slippery surfaces, as we talk about the tree and the branches. So be careful of these things. Let's say hello to Sonia Singh, my dear, is watching. Let's see what she says. Mr. Kenneth Rampersaud, how are you? A pleasant good evening to you and your family. I want to say good evening to you and your family for your love and your support. I know that Sonia Singh lost her brother just a couple of weeks ago, and the last time I was on the show, we extend our deepest sympathy to her brother who passed away. I thank you, my deepest sympathy to you again. I hope that you guys are doing well and is coping well with the loss, and thanks for your support. Nanda C, thank you very much. Missy Boo, yes, she said she loved my show. I know sometimes some of you can watch it, but you know what? You can watch it later on. Always don't forget to share. To my very good friend, Radhika Jaikaran, I know she watches my show sometime 2 times, which is a good thing. Let's see, Radha Totaram, good to have you guys on. Naidu, thank you very much. Let's go, DJ. Special hello to Priya Prasad mom. She always loves to watch my show in Guyana.
जिथे जावे तू ओथे जावे दिल दस की मैं करूं जो तू रुस जानिए दिल ये टूट जानिए तेरे संग संग राह सारी कट जानिए जो तू रुस जानिए दिल ये टूट जानिए तेरे संग संग राह सारी कट जानिए मैं ता तेरे नाल रहना मान इन्ना मेरा कहना मेरी अखियों से होना कदी दूर ना तेरे बिन
Chandra Collier, a very good evening to you. You are watching the Ken Rampersaud Show here on Island Zone Radio. Thank you for watching my show.
तेरे संग संग रह के मैं रंग जाऊं तेरे रंग तेरी नींद से ख्वाब मैं अपना जोड़ लूं तू साथ ना हो तो चार कदम ना चल पाऊं तेरी राह पे राह मैं अपनी मोड़ दूं
ओ जग भूल जाए मुझे तुम नहीं भूलना तेरे संग जीना मेरा तेरे संग ढलना सच्ची चाहतों का होता कोई मोल ना तेरे बिन
तेरे बिन नहीं लगता दिल मेरा ढोलना कि तेरे बिन नहीं लगता दिल मेरा ढोलना सब छट जाए तू ना मैनू छोड़ना
Sandra, I hope it's bringing back good memories for you. I want to say thank you very much for watching my show, Sandra. That's right, you're watching the Ken Rampersaud Show. I know it's bringing back some memories for some of you, and I hope my DJ is listening. Priya Prasad, your mom, thank you very much. I know for those of you who don't know, Priya is one of the admin on the Ken Rampersaud Show, which is this show. Always very good and kind and supportive behind the scenes. She does a lot of things for my show to make sure that the show is still here. So Priya, I want to say thank you very much to Sandra. I want you to know when she's probably watching my show, I want to say thank you very much for letting her grow to do the things that she loves. Also to DJ, they want to hear back this song, Vikahi. People will love this song, so we're going to play back for the third time on the show. The other thing is that, you know, I would love to interview him on the Ken Rampersaud Show. So if any one of you know him or could connect him to me, to my show, let me know, and so that I can get a chance to talk to him on the Ken Rampersaud Show. So let me play the song back for you guys, and then I'm going to tie things up back again since you guys requested. You ready? Okay, so while DJ is getting that song ready, I'm going to go ahead and talk a little bit more. Fire safety, according to the U.S. Fire Administration, adults over 65 years or older are 2 to 6 times percent more likely to die from a fire than the rest of the population. Use these simple senior safety tips to prevent elderly death and injuries from fire in your home and community. Make sure you have a working fire extinguisher at home at all times. Keep your fire detector and carbon monoxide detector up to date by checking the batteries regularly and prompt replacing expired batteries. Also, have a professional or plumber clean the vent of your dryer. As we have said before, we have actually, it causes 2,900 fire yearly, which is caused a lot of fire. Okay, so get them clean. Never dry object containing foam, rubber, or plastic. These include shoes or rubber or bath mats with rubbers. And I know a lot of people like to do this until you start smelling it and you start a fire, then there's a problem. Don't leave your dryer running when you are sleeping or not at home. I know sometimes, especially here in the States, Canada, we want to go put our clothes to dry. And guess what? When we put them to dry, we go to sleep and then there's a fire. Don't, if you're smoking, or your smoke or carbon monoxide detector are more than 10 years old, replace them. Remember that carbon monoxide is a deadly, odorless and colorless gas. You cannot smell it or see it. Having a working carbon monoxide detector is crucial to senior safety. Smoke inside your house is not safe. In fact, we recommend that and encourage all seniors and adults to quit smoking in order to decrease the risk of senior health problems. However, if you're a senior smoker, make sure you never smoke in bed or anywhere oxygen is used. And I have to tell you, this is one problem I have with some of my patients. They're always smoking in bed. When I go to their bed, I'll see the burn mark on their sheet, and which is not a good thing. And some of them is an oxygen and could blow up the whole house. I want to say hello to Uma Ramsarup that's watching all the way from Berbice. Thank you very much for all the things that you do for those children. Also, heat your home safely. Do not use an oven as a heating source under any circumstances. Turn off all heaters when you're leaving your home. Leave at least 3 feet space around your heater. Don't put cloth or paper next to your heater. This is called a safety zone and it prevents object from catching fire. Never leave your stove while you're not at home. I know sometimes people like to leave their water at home, heating themselves, the house. That's not a good thing to do. You want to remain in the kitchen while you're cooking. Never leave your cooking stove or cooktop unattended. If a fire does break out in your home, you want to call 911 immediately. Don't try to put the fire out by yourself. And you don't want to leave any candle or fireplace burning in an empty room. You are watching the Ken Rampersaud Show. And here's another the same beautiful song that we played 2 times. That's popular demand. Sandra, this is for you and all the beautiful ladies that's watching. Again, please don't forget to share my show, the Ken Rampersaud Show. Let's go, DJ.
You don't know what you have until it's gone.
Okay, Maria.
Now you're up and gone away, baby. Didn't wanna stay, baby. I wasn't to play, baby. I just want you here, baby. Where you really want me to. Should I know my love for you is true? Girl, you been telling me that you're never gonna leave. Girl, you been telling me that you're never gonna leave. Girl, you been telling me that you're never gonna
That's right. You're watching the Ken Rampersaud Show. I want to say this, but before I say that, say anything, I want to say a very special hello to my co-host, Miss Shanaz Hussein, who is locked on, and it's always good to have Shanaz on the program. Uh, I hope you're having a good day, Shanaz. I know today is probably her late day sleeping. And, you know, as we're talking, I also want to say my deepest sympathy to Maria Harris on the loss of her aunt who passed away. On behalf of the Ken Rampersaud Show and all our viewers, we'd like to extend to you our deepest sympathy. You know, as we're talking about love and this song so much this evening, you know, I've always liked to tell young people, you know, I'm now 56, it's always good to take your time and make sure that you fall in love with the right person. You don't want to fall in love with someone who later on that you're going to regret. Because love makes us do a lot of crazy things. So take your time and fall in love with the person who is going to serve you best, because sometimes we fall in love with someone who abusing you, who's going to beat you, who's going to do all manner of things. Again, take your education, go to school, take your education, give life your best shot, because in life sometimes there's a lot of problems come ahead, and one of the things that you want to do is that in case you lose your partner halfway of the journey, that you will be able to take care of yourself and to your family, okay? Make yourself marketable. Initially, make yourself marketable. Take your medication and do what's best for you, okay? Love and boyfriend and girlfriend will come at its own time. I know Deo Moti is asking if I'm on. Yes, Deo, I am on. Let me know when you tune in, Deo, so that I can, or somebody could let Deo Moti know that I am on, so I can extend my sympathy to her. It's good to have again Kayum Khan, and I know Kayum knows a lot of what I'm talking about. You have a lot of time left in your life to fall in love. You know, sometimes these 16 years old girl go fall in love and they get away with these boys, or the parents are forced to marry them together. They go, they get 6, 7 children, and the boyfriend later on found out that, you know what, they fall in love, fall out of love, and they leave her with 6, 7 children. So guys, please make sure, or girls, please make sure you do what is right. And as we're talking about Alzheimer's disease, if any of the appliance power cord is damaged, you want to replace them. Prepare in advance for a fire. Know that the easiest way to leave your home and to be familiar with at least 2 exits in your home. Do not overload power cord, which sometimes we all do, socket or extension cord. Also, senior fire safety statistics. We know that seniors 65 plus are 2 times more likely to die in fire compared to the rest of the population. In those adult over 85 years, the risk of fire death is 4.1 times higher than the total population. Every year, approximately 2,700 nursing home fire are reported in the U.S. Smoking, never. We don't want you to smoke near any oxygen cylinder or anything that's a problem. Also, we want to make sure a car safety to ensure elder security on the road. We encourage families and caregivers to have open conversation regarding elderly driving. And we have to be very careful. How do we let people who are our elderly, 65 years old, or people, I know some people 65 and still driving, but how do we allow those to drive who have Alzheimer's? You don't want them to go on the road and next thing you know, they get lost, okay? Here is some other tips we want on how to keep your aging family members safe while driving. Keep the car door locked at all times. Make sure your vehicle is being serviced periodically, and as soon as you detect any malfunction, take it to the mechanic. Never leave your purse or your on the passenger's side. Place it on the floor near to you. Don't leave your car window wide open. Open them as much as possible if necessary to allow air and but prevent someone from reaching inside of your car. Drive only in streets where you know. Don't go to places where you don't know. Avoid driving at night if you're older. However, if you must drive while in the dark outside, make sure you drive a well-lit area and the road, and try to have a friend or family member accompany you. Always wear your seat belts, which we have said. This is particularly important for senior safety. Keep all your valuable, item locked and out of view in your trunk. Do not keep your personal items such as the name and address on your key chain. Park in a well-lit area. You don't want to park and people can come and see all that's going on, right? We have like 8 minutes more to go on the show. Also, probably we should get a song now, and when we come back, we will tie things up again. You're watching the Ken Rampersaud Show. Let's go. We have the man Rajiv Nandalal holding on.
गाता रहे मेरा दिल तू ही मेरी मंजिल है कहीं बीते ना ये रातें कहीं बीते ना ये दिन कहीं बीते ना ये रातें कहीं बीते ना ये दिन
We all love the old songs, eh? Bring back so much memories. I think of my parents when I'm hearing these songs. Ravindra Puran has made us very proud. He lived just a couple villages away from me in Guyana. Good evening, Meena Kalu. Nanda, I was never a teacher. My first job is a nurse in Guyana. I was trained as a nurse at a public hospital. I couldn't be a teacher. I don't know a lot of things. My head was hard back then. I'm sorry, I have to cut this song off because there's so many information I want to share with you guys. Be aware of your surroundings at all times. We don't want you to be falling asleep on the subway or taxi while waiting for bus and all these things. Don't leave your purse unattended. When you go shopping, consider replacing your purse with a fanny pack, the one in front of you, where you will see all the time. Never let strangers know that you live alone. Never let them see that you can see through your house. You want to have your blinds on. If you have any kind of work to do, make sure you bring over some family members to see what's going on. You don't want people to be able to walk on the street and to see you guys there, okay? Also, we know cybersecurity. You don't want to do anything transaction online. There's so many people that's calling, that's going online trying to get your information. They can steal your stuff, your social security number. Also, guys, you don't want people to be calling you on the phone. You don't want to give your phone out, your phone number out, or your social security number out. Let your family, your younger family members deal with these kind of a problem. Don't give especially your social out. Don't write your checks, blank checks to people. A lot of people call sometime and want to do that. Another thing with food safety, a lot of older people, what they do sometimes, they cook a lot of food, they leave it in the fridge, and they want to eat it, or they get food from, Meals on Wheels, they have it in the fridge. You don't want them to eat these kind of a food. You don't want them to do that, not at all, because food poisoning can be very bad. I'm going to ask the DJ to play another song in just 2 minutes. I have 3 minutes more to go, so I can talk in between the song. Get rid of your food, throw them out. Don't keep it around, okay? Always wash your hand before you start dealing with your food. Food poisoning is a very bad thing. You don't want to put your raw food with your cooked food. It's no good. If you go at your parents' place and you see that they have old food, what you want to do, is to throw it out and get fresh food for them. Don't give any kind of credit card information to your family, to strangers out there. People call online and so on. Always make sure you take care of them. Don't sign any paper that you're going to sell your house. A lot of times people prey on the older people to do these kind of things. Okay. Also, you want to check your family bank account often and regularly. Make sure that people don't get into your bank account, especially if you are living in North America. It happened a lot here in America where people just prey on the older folks. Okay, guys. Don't let anyone force you or pressure you into doing things. All right. And the best thing to do, especially with fire, and a lot of times, what you want to do, if with your jewelry, your bank book, your house papers, and so on. One of the things that you want to do is to make sure that you have a safety deposit box at the bank where everything is insured, and that in case of a fire at your house, you don't have to worry about these kind of things. We got 1 minute, so DJ, run a tune. I'm going to talk to you guys while he's playing that tune. I'm going to talk in between. I want to say thank you very much, guys, for watching the Ken Rampersaud Show here on Island Zone Radio. My show airs every week from 5 p.m. to 7 p.m. Melissa Marie, a very good evening to you. Hemrani, Savory, good evening to you, my dear. To all of you watching my show, I want to say thank you very much for watching the Ken Rampersaud Show. Next week, I'll talk a lot about diet. What's food that's good for the food that is good for Alzheimer's, dementia. Also, what is good for people who's going through the pandemic now. We want you to make sure you eat a balanced diet that's good for you. So I'll dig into that next week. I'll bring you some information. And again, thank you very much for watching the Ken Rampersaud Show here on Island Zone Radio. Please continue to share the program to your friends and your family, okay? Until next week, have a very pleasant evening. Shanaz and myself would not be on tomorrow. I'm working 16 hours tomorrow. So see you guys. We're coming back next week, all right? Take it easy. I have to head up now to pick up Gita. She finished working at 7:30. Until then, next time, God bless you all, okay? Thank you, guys.